Professor Bonga Chiliza is the new president of the South African Society of Psychiatrists. He says he's ready to dramatically improve the profession. His aim is to encourage young medical students to specialize in psychiatry. He says this will help serve the public mental health care needs of the country. He joins us now from our Durban studios. Thank you so much for your time tonight, Prof, and congratulations on your appointment. You certainly seem to have come into this position with a very clear vision of what you would like to do. How much have you learned from the incidents that we've had in the country where mental health was not given the attention that it deserves?
Yeah, good evening, Kathy, and thank you very much for interviewing us, for interviewing me tonight. Yeah, I think that this is a very poignant time in our country with the tragedies that have happened in the last few years, like the Life Esidimeni tragedy, what happened down in the Eastern Cape with the alleged abuses of human rights that may have happened at Tower Hospital. And of course, we mustn't forget about the death of our senior colleague, the Dean of the UCT Faculty of Health Sciences, Professor Bongani Mayosi, who committed suicide following his battle with depression. So we really feel that the time is right for us to put a renewed focus on mental health in our country. And clearly our mental health services need to be significantly improved to try and cater for this increased burden that we are seeing all around us in our country.
Well, from the outside looking in and having studied what has happened in the country, as you take up this position, where do you think the greatest weaknesses in the system are currently?
Yeah, so I work in a government hospital setting, and I work at the university, and we definitely feel that our government hospitals, where the front line of mental health care should be, is in the district hospitals. So in the hospitals like in Johannesburg, it's called Helen Joseph Hospital, for example. Mm-hmm. In Durban, perhaps King Edward Hospital, and Karl Bremer Hospital in the Cape. So if you go at any time to casualties in these hospitals, you'll find a lot of young men lying on stretchers, sedated, battling with psychosis from some kind of schizophrenia or a drug-induced kind of psychosis. And we really feel this is where we should be ramping up our care for our people. Because what happens is that then these hospitals get clogged up, and our patients wait for many, many hours, sometimes days, in these casualties on the stretchers, waiting for the right kind of care, which is, of course, very traumatic to the people and, of course, to the staff that is there. So we think that is where probably we should be spending a lot more effort and money trying to improve the services at that area.
And in terms of diagnosis, do you find that it's challenging for perhaps medical professionals who are not psychiatrists to then be able to diagnose those very individuals that you've spoken about who are lying in hospital for these days on end, waiting to receive proper care?
So the challenge is really not necessarily the diagnosis. We think that most medical doctors now, especially the younger ones, have adequate training in psychiatry. They spend a lot of time in psychiatry during their medical school days. So I don't think necessarily the issue is the diagnosis. I think that a lot of young doctors who are not in the psychiatry field are still lacking a little bit in confidence in terms of the proper care and treatment of our patients. I think the issues are really not necessarily about diagnosis, but about how to keep our people who have psychosis and bipolar taking medication for a long period of time. So these are, as you know, these are chronic, lifelong illnesses, and one of the biggest challenges that we have is how do we make sure that our people keep taking medication so they can stay out of hospital. And the system is really struggling to find sort of answers for this. We've looked at other examples, for example, in HIV and in TB in this country, where they've got these programs where they can try and put people on and keep them on medication for as long as possible. And we're trying to see if maybe we could use those kind of examples also in mental health care.
And do you have a plan in terms of how then you're also going to attract more young people to specialize in psychiatry, given the big need that there also seems to be?
Yeah. So there's a couple of things that we do have a plan, and there's a couple of things that we like to do. One of the issues that is that the battles that we've won is that we've made psychiatry equal to other disciplines in the medical school career. So every single medical student that passes and becomes a medical doctor in our country now spends a decent amount of time in psychiatry, and we're very pleased about that. But the battle has not been won yet in when they then become interns. And during internship, unfortunately, they only spend 1 month in psychiatry, where else they spend 4 months in surgery and gynecology and other disciplines. And so a lot of young doctors during that critical time, which is actually still part of their learning, are not getting the proper teaching and exposure to psychiatry. So we are asking for the Health Professions Council to say, can you please look at increasing exposure to psychiatry at this time? And also maybe during the community service time, when the young doctors are out in the communities, a lot of those posts where they're working at are not in psychiatric hospitals. And so we are asking for parity along those kind of lines.
All right.
We've also wanting to attract the best medical students to do psychiatry. So there's a drive in all the different medical schools to talk about the sexiness of neuroscience. You know, it is really the latest and most interesting part of the field of medicine, and so we are pushing for the brightest medical students to join us in the academia, particularly in research in neuroscience and in psychiatry.
All right, fantastic. Well, we'll certainly be watching to see what exactly the association gets up to under your helm, under your watch. That was Professor Bonga Chiliza. He is the president of the South African Society of Psychiatrists.